Kayla Hathcox here, student physical therapist assistant. Come to you live from the Jeff State Community College campus at the General Studies Building. Tonight, we're going to be discussing MRSA. Breaking news. It's everywhere. Who gets it? What is it? And where is it? So first of all, MRSA. What is it? MRSA is Methicillin-resistant Staphylococcus aureus. It's a strain of staph that is resistant to methicillin, which is a common antibiotic. S. aureus, or staph, was first treated with penicillin, but the misuse of the drug caused the bacteria to evolve and become resistant. Methicillin was then used to counteract the resistance to penicillin. Therefore, the bacteria then became resistant to methicillin as well. The first case of MRSA was diagnosed in the United States in 1968. How is it transmitted? It's transmitted by direct contact with colonized surfaces or people. The bacteria cannot invade through intact skin or mucous membranes. Once the bacteria enters the body, it will then secrete enzymes and toxins that harm healthy tissues. The local immune response is a pustular red bump that can penetrate deep into the tissues and cause significant damage to bones, joints, muscles, etc. If the bacteria can get past local defenses, then they can enter the bloodstream and spread to any part of the body. This is a really great picture that I found of the skin, the infected area, and it's showing where the bacteria is and the white blood cells that cause the pus. Alright, got some gnarly pictures coming up here, so just hold on to your seats. This is the early stage of MRSA. So as you can see, on the left we have spider bite, and then on the right we have MRSA. This one, you can actually see where the tissue is a lot more red. You've got some necrotic stuff starting over here, and you've got the red pustular bump. Now this is later stages. This is what happens when it goes untreated. We don't want this. Got a lot going on here. Dead necrotic tissue right here. Nah, no good. Don't want it. So, who gets MRSA? Well, nosocomial MRSA is usually found in patients that have had multiple administrations of antibiotics, invasive surgical sites, and joint replacements. Patients with multiple portals of injury, i.e. catheters, IVs, are also extremely susceptible to MRSA. Nosocomial MRSA is spread via healthcare workers' hands, which is why MRSA poses such a threat to the healthcare system. Who else gets it? The elderly are at a higher risk for MRSA due to frequent hospitalizations and a decline in their immune system. Patients with an implanted medical device are also at a greater risk, and patients living in long-term care facilities are at a greater risk. So just a few stats. It's estimated by the CDC that 1 in 20 hospitalized patients will contract a nosocomial infection. One of the most significant nosocomial infections is MRSA, and each year 126,000 people will be hospitalized with MRSA, and 19,000 deaths will occur. So, how is it diagnosed? Well, a patient's diagnosed with MRSA by collection of a sample from the infection site and then sent to the lab for testing. The sample is then tested for signs of drug-resistant bacteria. The sample is placed in nutrients that encourage bacteria growth, which usually takes about 48 hours, and the drugs are then tested on the sample to see if the patient has MRSA. Who is tested? Patients that have an infection, that have been transferred from another facility, and patients who have recently had MRSA are all tested during their hospital stay. Where does it live? MRSA is most commonly colonized in the nares and can be present there for at least 1 year. Colonization risk factors include prolonged hospital stays, stays in the ICU, recent hospital admittance, and invasive surgery. So treatment for MRSA. Vancomycin is the most commonly used drug treatment for MRSA. Other antimicrobials approved by the FDA are also being used. Topical antimicrobial usage is on the rise to prevent high-risk patients from infection, but the effectiveness is still questionable. Treatment and prognosis. MRSA vaccines are not yet available available but are currently being studied. The prognosis for nosocomial MRSA is good with treatment, but there continues to be more evolving resistant strains which present a greater problem for the healthcare system. So if the MRSA spreads to the bloodstream, any system can be affected, which can cause many limitations. For example, the bacteria can affect the patient's breathing by spreading to the lungs, which is also known as MRSA pneumonia, and can lead to the use of a ventilator. After the patient is weaned from the ventilator, it can result in shortness of breath, which can affect their mobility. So what does this mean for us? This means that therapists need to properly educate the patient and their families about how to protect themselves and prevent future infections. This means proper hand washing and the use of proper PPEs. Patients with MRSA may require therapy for various reasons depending on where their infection is, how it has affected them, and the severity of their infection. Returning the patient to the highest possible level of function is the main goal and can hopefully be successful with patient compliance, proper physical therapy, and focusing on a team approach. MRSA falls under practice patterns 7A, 7B, and 7E. As we've already discussed, nosocomial MRSA is typically transmitted via healthcare workers. So proper hand washing and the use of appropriate PPEs is crucial in preventing the transmission of MRSA. If any equipment is used during the session, it should be properly cleaned and disinfected with a specified germicidal cleaner. So this was a great picture that I found. All these little yellow spots here are indicating where the MRSA is colonized at this point in time. This room could have just been cleaned, but yet it's still here. So guys, it's really important that whenever you start working somewhere at a hospital, long-term care facility, wherever, you'll see people go in rooms with patients who have MRSA and they won't wear PPEs, they won't wash their hands. Don't fall suit to that. Always protect yourself and protect your other patients as well. So as we conclude, we know that MRSA is a serious and often fatal infection that can cause serious issues for patients and the entire healthcare system. It's our responsibility as healthcare workers to follow the rules of proper hand washing and wear all the specified PPEs so that we can protect ourselves, the other staff members, and most importantly, the patients. Thank you, and have a good night.